The threat of the Ebola virus sneaking into the country has triggered cautious preventive measures across the country's entry points, especially at the Jomo Kenyatta International Airport. The Ebola scare is enhanced by the fact that the virus that has no proven cure kills up to 90% of its victims. But there is a ray of hope for a possible cure from a very unlikely source. Now, according to the World Health Organization, the blood of Ebola survivors offers real hope of a remedy.
We agreed that whole blood therapies and convalescent serum may be used to treat Ebola virus disease, and that all efforts must be invested into helping affected countries use them safely.
The blood medicine works since people produce antibodies in the blood in an attempt to fight off an Ebola infection. Now, the theory behind it is that these antibodies, when transferred from a survivor to a patient suffering from Ebola, would then boost the immune system.
Absolute need to
Briefing the press in Geneva, Kien, who is the Assistant Director General, said the survivor's blood test is being conducted in several parts of the world. The WHO has also announced that the Ebola vaccines could be ready by November.
2 promising vaccine candidates were identified. One is called chimpanzee adenovirus Ebola and the other one VSV Ebola.
If proven safe, a vaccine could be available in November 2014 for priority use on healthcare workers. Meanwhile, Sierra Leone has announced that it will impose a 4-day countrywide curfew in an escalation of efforts to halt the spread of Ebola. The West African nation residents will not be allowed to leave their homes between September the 18th and September the 21st in a bid to prevent the disease from spreading further and to allow health workers to identify cases in the early stages of illness. Willis Raburu, Citizen Weekend.